When I stopped doing obstetrics back in 2002, the demographics of my practice changed greatly. So all of a sudden, I had a great increase in business women and women in the 40 and over age group. And their conversation, the business women said, I just don't want my doctor dodging out to go deliver a baby. I appreciate babies, but I'm here because I have no time and I want to get this done. And the 40 and over said, listen, I have a whole lot of other problems. I just don't want to talk about babies. And so as my practice changed, I realized I was having the time to discuss some of these other things like hormones and sex and how their partner functions and how their relationship is and so forth. And as I got into that, I realized I wanted to know more. I wanted to know what research was out there. And so I started with the International Society for the Study of Women's Sexual Health and moved forward in that direction. So in our clinic, we see men and women, we see couples, any type of couples, heterosexual couples, homosexual couples. People come for a variety of complaints. So for men, erectile failure, but probably more often is premature ejaculation. For women, low desire by far, but sexual pain is a very close second. It is amazing how much sexual pain is given some obscure diagnosis when really there's some regular GYN things that we can do to fix some of the basic stuff. We see young people and old people, so sometimes my clients are in their 80s and sometimes my clients are in their 20s. I just never know what I'm going to get. So we always advocate for safe sex. So everybody knows safe sex is a latex condom or a polyurethane condom. But the reality of that is, when you get into your 50s, a condom can be the killer of the erection. And so you have to have a plan B that's realistic in someone's life to help them manage that. So I'm very big on STD testing before the first intercourse for both parties. And let's swap results. I'm usually the facilitator of that. And that way, if they're unable to use a condom, they accept the consequences, and we've done some testing, and hopefully they're in a monogamous relationship at that point, and frequent testing thereafter. But of course, we always give the basics. Here's what the rules are. Because a lot of it is the relationship. But why does the marriage break apart? Because someone's not getting enough sexual intimacy. So when people visit me, I want them to know, A, I need your time. I need an hour of your time to start. That B, everyone goes home from the first visit with some tip that will help change the way their relationship was when they came to me. That it's not going to be ongoing therapy for most people. That C, there may be a medical problem that I can change, whether it's a medication or a hormone or something that will alter the dysfunction that's happening. And that I'm open to discuss just about anything. I have not come across anything I wasn't open to discuss. I'm not always knowledgeable about a particular fetish or fantasy, but I can become knowledgeable and try and help that patient. I think that patients need to know that sexual health and intimacy is an integral part of wellness throughout the lifespan. So whether you're 19 and 20 and just figuring out how you function sexually, or if you're in your 80s and you're trying to figure out how to enjoy sex after a hip replacement, with back surgery, with erectile failure, with vaginal dryness, or whatever, heart disease, that there is a way, and you should never sacrifice your sexual wellness throughout the lifetime, because we can adjust somewhere in between.